This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
As
opposed to
Health first or
Medical Dilemma.
Hello, my name's Sunny Del Rosario. Wait, that's not true. My name's Harry Tambuatco. Welcome to Medical Dilemma. I'm sitting in for Sunny. Now, this is going to have to be the serious face. No politics, just education, information, issues. But before we even get to that, we are going to talk about a medical expertise first, wherein the subject of the dilemma centers upon a specific expertise. With us, we've got Dr. Jessica Abano, that's with an N, not without an I. She's an ophthalmologist. She is an expert on the cornea and refractive surgery. Let's find out exactly what that is. Hi, Doctora.
Hi.
Thanks for being here.
Yes.
Exactly. Pag sinabi mo ophthalmologist, yung dalawa na kagad, yung cornea and refractive, not necessarily.
No, not necessarily. When you say ophthalmologist, it means you are a specialist of the eye.
Okay, so anything that has to do with the eye becomes an ophthalmologist.
Yes.
But in your case, you have become an expert on the cornea specifically, and as well as refractive. I guess you'll go into that in a little while.
Yes.
Ang ophthalmologist, marami na ba po sa Pilipinas?
The Philippine Academy of Ophthalmology is an organization of ophthalmologists.
Yes, yes.
We have 1,500 members, roughly around there.
That's not very much in comparison to 1 million people. 100 million people, is it?
Yes, it's not.
And in the cities, well, Manila, Cebu, and Davao, and the main area, especially in Metro Manila, marami tayong mga specialists or ophthalmologists. How about in the countryside? Yung mga general hospitals and smaller, pagdating sa probinsya, lalo sa mga libliban, meron tayong mga ophthalmologists doon.
Meron din po tayong mga ophthalmologists doon. In the provinces, we do have ophthalmologists as well. Pero yung sometimes yung really far-flung areas,
Wala
yun ang
na.
wala.
Anong trabaho ng ophthalmologist? Kumbaga, kung wala na roon, pero okay, ophthalmologist, nasa association siya, it does not mean they are experts in other surgical procedures and whatnot. Parang medical doctor, general practitioner. May general practitioner na ophthalmologist.
General ophthalmologist.
Yun ang tawag
we call
doon,
it
general ophthalmologist.
And
Marami
then,
yan.
Marami din po.
Hindi yan yung sa mga optical shops na nagbebenta ng mga
Ay,
iba-ibang
hindi po.
sariwang salamin,
Yes.
ano?
Ang ophthalmologist is a medical doctor who specializes in diseases and surgery of the eye. And then if you go to further subspecialty, like any specific part of the eye, then you become a subspecialist. So
Subspecialist ba yun?
Yes, subspecialist.
So, ophthalmology is not an optometrist. Iba pa yun, di ba?
Iba pa po.
Iba yung sa mga salaminan.
Iba po.
Tsaka
Iba
mga
po.
nakaputi, tapos titignan mata mo, maraming ganun-ganun sa mga mall.
Yes.
Ang ophthalmologist, tinitignan talaga kung may sakit ka
Sa mata.
sa mata.
Yes.
When do we see one? Kung masakit ang mata, kung hindi na tayo makakita.
Oh,
Parang ganun eh.
mas importante, if you have any symptoms, eye redness, eye pain, or really blurring of vision, then
My eyes are red, so I should go and see you. Seriously. Pag namumula lang ang mata mo, ibig sabihin nun, you should go already and have your eyes checked.
well, there are certain diseases of the eye that manifest lang as eye redness or pamumula lang ng mata, but actually is secondary to a systemic condition. Halimbawa po, may arthritis ka, and then you have eye redness. Usually, ang eye redness, pag only a certain part of the eye, secondary siya sa systemic condition or condition ng other medical condition.
So it could be a symptom, it could be a consequence, it could be a
Yes,
side effect,
yes.
or could be the main cause as
Yes,
well. Oh my gosh, so kailangan pala puntahan.
Yes.
And when you choose an ophthalmologist, how do we go about it? Anyone that's a general ophthalmologist? That's the first.
Yes. Yeah. Well, we have a lot of ophthalmologists in the Philippines. As I mentioned earlier, we have somewhere around 1,500 members of the Philippine Academy of Ophthalmologists. So anyone, if you have symptoms of the eye, meron po tayong mga ophthalmologists near your area. That's where you should seek opinion. And then, kung the nearest part, kung saan ka malapit, then that's where you should actually consult.
So, when you consult, you go for a general practitioner first of ophthalmology, and then you're diagnosed. That's when you identify the expertise. Is that correct? Or the sub-expertise?
Okay. Most of the ophthalmologists can diagnose most of the medical conditions and surgical conditions of the eye as well. However, pag it's beyond the doctor's expertise, that's when he refers to another doctor.
Ganon.
Yes.
Madalas kasi po ngayon, marami nagpapascrape ng yung sa pag dumidilim na yung mata, pag ang paningin dumidilim. Yung iba naman nagpapalagay ng pakulay sa mata. Yung iba naman kung anong ginagawa. Pero parang outpatient lang yan sa mga hospital dito eh. Ophthalmologists ang gumagawa po nun.
Usually, ang surgeries of the eye, lahat ophthalmologists ang gumagawa. Surgeries ng eye. Ophthalmologists.
Let's
dapat.
go to your expertise, your sub-expertise. We've got an eye on the table, ladies and gentlemen, and I mean literally an eye that's broken down to help us understand exactly how the eye works. Doctora, I'll give you the screen.
Okay. So, the diseases of the eye are quite difficult to understand.
Ito muna lagay natin bago yung screen.
Yes.
Yung mata na hawak niya, it's actually cracked in half. She's holding a watermelon here.
There you go.
Here you go. Ito yan, correct. Doctora.
Okay. So it's quite difficult to understand the eye unless you have a diagram like this or a... So if you look at the eye, what you see is the brown part. The brown part is actually what we call the iris, this part. Okay? In front of that, there's a transparent structure which we call the cornea.
That's the cornea.
This is the cornea. This is where I specialize in.
Just that. But you understand the whole procedure. What is the orange portion with the veins? Veins
Okay.
seeming like vein.
Okay. Behind the eye, this is the lens of the eye. Ito yung nagkaka-cataract.
Ayun.
Okay? This is the one na nagkaka-cataract.
Ano yung mata? Lahat yan ng mata.
The whole thing is
The
the,
whole
eye.
thing is the eye, okay.
Yes, the whole thing. And then this yellow portion, we call it the retina. Nandyan yung mga blood vessels. If you were to compare the eye to a camera, the retina, or the yellow part there, is the film of the eye. So it captures the image and brings it to the brain.
Okay.
So different parts of the eye will have different subspecialties. So if the problem is in the cornea, usually we refer it to the cornea specialist. If the problem is in the retina, usually we refer it to a retina specialist.
And if it's this portion, the lens.
Most of the ophthalmologists
That's a cataract,
yes,
where you have the cataract.
Yes, most ophthalmologists do cataract surgery.
They do cataract surgery.
Yes.
And when you reach into this is a solid body, I assume the top portion. That whole thing's solid.
Yes.
With nerves all around it.
Yes.
So to get to the
To
cornea,
the lens, to the cornea.
to the cornea, you actually slice the eye in half
No.
to get to it?
No, actually, we just make an incision here in front.
Okay.
We don't slice the eye in half.
And when you improve the eye, when there's a damage, and you do, when you harvest or what you call transplant with today's technology, you can actually replace this if it's damaged, if it's
Yes.
cracked, and how else does it degenerate?
Okay. Since this is the cornea, if it gets opaque or if it gets white, you won't be able to see clear anymore. So those are diseases such as corneal scars. If you have trauma or pag natamaan yung mata,
Pag tinamaan,
pwede kang magka-corneal scar.
can it degenerate on its own because of poor health?
There are certain diseases that can cause weakening or abnormality of the back part of the eye.
Yes.
We call that dystrophy, and that one can also cause blurring of the vision
This
because
is your specialty, this
Yes.
front portion.
this front portion.
And another person would do the iris, and another person would do the rear portion.
Usually, if it's a retina problem, a retina specialist or a retina surgeon would do the surgery.
Very interesting, and very seemingly intricate, and very puzzling. You have a presentation here.
Okay. Usually, diseases of the eye will, diseases of the cornea will need corneal transplant. So that is when we remove the part of the cornea and then replace it with a donor cornea from a cadaveric donor,
Patay.
from a dead person.
You harvest.
We
basically.
do have the Philippine.
This is an organ, correct?
Yes.
This is part. Okay. Yes.
Yes. So it's part of an organ transplant. So the cornea is usually from a donor, a cadaveric donor. The Philippine Eye Bank or the Santa Lucia Eye Bank, we gets the cornea from the donors, and then they make it in such a way that they make it sterile and then fit for surgery. So there are two types of corneal transplant. One, we call it penetrating. The whole cornea is transplanted, and then sutures are there to keep it in place. And the other one, we call it lamellar keratoplasty, or only the inside portion of the cornea is transplanted. So it's sutureless. So to further discuss that,
Okay, we'll go to the computer presentation now. Okay.
So here,
Yes.
this is an example of penetrating keratoplasty. See the cornea there, and there are several sutures to hold the cornea in place. On this other side, we have a diseased cornea. You can see that the cornea is
oo nga naman.
swollen. You can't see the inside part of the eye. This is after transplant.
It clears up.
Yes.
So when you do that, it's not the whole eye or penetration. It's really parts of the eye that you're
Yes.
correcting.
Yes.
And when you say you get it from a cadaver, patay na tao, may organ donor.
Usually po.
Naku, magandang dilemma ito pag-uusapan. So we're going to have to take a short break, ladies and gentlemen. The reason for this first 10 minutes is to introduce the expertise of Dr. Abano, and basically to understand exactly what the specialty is all about. Believe me, there would be medical dilemmas, but that will be until we come into the second episode. But before we go away, we'd like to call attention to the sponsors of the show. You have St. Clair's Medical Center, you've got the Makati Medical Center, and you also have the Life's Quest Consultancy Group. So stay with us. We'll be right back, and we will bring in the rest of the troupe, and we will tackle the issues that grapple the mind. We'll be right with you.
Many of our products were designed to be used in industrial and medical economy.
mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?